Greetings, lab. Today we're going to be talking about a shoulder technique called Spencer's technique. And this is great for frozen shoulder, but also wonderful for anyone with chronic shoulder pain, especially a pregnant woman.
Thank you.
No side effects for OMT, per usual. Encourage your patient to drink plenty of water afterwards. Beforehand, you can counsel them on they may feel some discomfort, but they should not be in pain throughout all these techniques that we'll be discussing throughout the curriculum. So I acquired this patient off the streets, and we're going to do some work on her today. She says that her right shoulder is bothersome, so pay attention as I position her appropriately. What do you prefer to be called?
Jennifer's good.
Excellent.
Jen.
Jen.
Yeah, that's good.
Jen, I'm going to have you lay on your side.
Okay.
I'm going to have your left shoulder down, and you're going to be facing me. So patient comfort here is key. I always put a pillow underneath their head, and if you could scoot more to this side. Excellent. So you want them towards the side facing you. And again, asking for feedback along the way. Please let me know if anything that we do today is causing you pain. It should not be causing you pain.
Great.
Okay. So to prime in Spencer technique, we're going to take their arm up like this and always instruct the patient, go ahead and relax your arm. So this is a passive technique, meaning that the physician will be doing all of the work. So if you ever feel like your patient is tensing up, you can gently remind them always to just let me do the work, relax, relax. So for the first step here is actually called milking. So what we're going to be doing here, and we're really going to be targeting this glenohumeral joint to prime it for the technique coming up. So what I'm doing here is just gentle figure eights that I'm directing towards that glenohumeral joint. And so I'm going to do this here about 10 to 15 seconds. And we can abbreviate it for the purposes of this video. So once you have milking done, you're going to go through a set of different movements that are also targeted at this shoulder joint to increase range of motion in all directions. So the first thing that I'm going to do here for Jen is go ahead and relax your arm. When I'm doing this first movement here, I'm going to lock out the joint up here so that, again, all the motion is right in this joint and it's not transmitting into her scapula or up her neck. So I'm just going to gently bring her arm up here. How does that feel? Good, good. Kind of, you're going to the point where it feels restricted and you're coming back. So we're in flexion and extension of the shoulder joint right now. So this is primarily flexion. As you can see, it does incorporate some principles of muscle energy. Relax your arm. Good. Great. So after we do the flexion extension motions, I'm going to move on to some traction motion. So applying gentle traction to that joint, and again monitoring up here, and we're going to move her in circles. It doesn't matter which direction you start with because we're going to cover the next direction afterwards. And we're going to go the other way, like I said. You still doing okay?
Yes, thank you.
Another thing I like to do during these techniques is incorporate some deep breaths. So always encourage your patient, anything can be activated further with a deep breath. So you can say big deep breath in and out. Good. And after I feel like I've done a good job on the attraction with the circumduction, I'm going to add some compression to that joint. And again, like we did previously, just gentle compression, blocking out the joint up top, going through both directions, clockwise and counterclockwise. Big deep breath in and out. Good. So after we've done those motions, the next motion we really want to target is internal and external rotation. This tends to be the most tender for the patient, so be extra gentle when you're placing them in these positions and ask for more feedback. How does this feel?
It's a little uncomfortable.
It's a little uncomfortable, yeah. So it typically is, especially this one. So I'm just going to do very, very gentle motions. So for this one, we're really focusing on
That feels better.
the internal rotation. Big deep breath in and out. Good. And then the external rotation. So monitoring up here. Kind of like a pumping motion. Big deep breath in and out. Good. So when we end, we're going to start out how we started. Go ahead and relax your arm. So we're kind of going back to that milking figure 8 action that we did to start with. And this will really loosen up any adhesions in the area. Again, reinforcing the restoration of range of motion in all directions. And that's the culmination of Spencer technique.
Thank you.
Thank you. Drink plenty of water.
Okay.